My name is Jubin Matloubieh, and I'm a urologist. I specialize in reconstructive urology and men's health. Patients come to see me for a variety of conditions relating to the genital urinary tract. This includes erectile dysfunction, low testosterone, blockages of the urinary tract like strictures of the urethra or of the upper urinary tracts. For various reconstructive needs, I get referrals, whether this is for reconstruction of the kidneys or bladder, genital, vaginal prolapse, a lot of incontinence, enlarged prostate, but really I'm happy to see anyone who comes in with any sort of urologic complaint. Things that I offer in the office include Xiaflex for Peyronie's disease, Botox for various bladder conditions, biopsies of the prostate or of the bladder, whether this is cystoscopy or ultrasound based. These are things that I can offer in the office, as well as vasectomies and urodynamics. And then in the hospital setting or operating room setting, I offer a variety of surgeries and procedure types, whether it's minimally invasive robotic surgery or endoscopic surgery, to more open surgeries. This includes genital reconstruction or abdominal reconstruction. I do perform many types of implants, penile implants, or different types of implants for incontinence for both male and female patients. And then I offer some vaginal surgery and laparoscopic surgery, again, trying to keep things as minimally invasive as possible. Andrology, men's health is kind of our lay term for this. It encompasses a variety of things. Certainly this includes the more common things that I see patients for, including erectile dysfunction or low testosterone, but this kind of encompasses a wider variety of conditions because often these are hallmarks of larger diseases or early signs of other diseases, and I become kind of the gateway to many other specialties: cardiology, endocrinology, primary care, and really helping plug people into the health system when they previously weren't. And so I like to think of men's health as being both, a specialty as well as, this gateway to providing this larger type of care for patients. I completed my medical schooling at the University of Rochester in upstate New York, and then I came down to Montefiore Albert Einstein College of Medicine in the Bronx, where I did my residency in urology. And then I went over to Columbia University in New York Presbyterian to complete my fellowship in male and female urologic reconstruction and voiding dysfunction. So I was looking around at a few different opportunities after I was finishing fellowship, and a few things really stuck out at me about Maimonides. The people who work here really seem to care about what they do in terms of their craft, and that their goal is really to provide high quality care and not just to focus on the bottom line. Patients and their families often choose Maimonides Urology because we really provide the full spectrum of urologic care. We really focus on what matters to patients, what are their goals, and we're really focused on providing that high quality care in a collaborative way. I love that in my job that I really improve people's quality of life, that there are these aspects of people's health that are working until one day they're not working, and these are things that very much define what it is to be a human, part of the human experience. And they come to me often feeling broken, and that I'm able to restore these aspects of their function and improve their quality of life. I've wanted to be a surgeon since I was in high school, since I was a teenager, and so this path was kind of just natural for me. I love that as a physician, I'm a leader in my team, that patients and other providers turn to me for advice for whatever, that I really can make an impact on patients' quality of life, that that can make their family members smile, or that I can sort of provide comfort in ways that in many other professions you're unable to. And it's really, this is like the most human part of existence is medicine and health, and so to get to participate in that, I consider it a real honor.